Today, I'll be talking to you about some basic anatomy of the knee. The knee joint complex consists of three bones, the femur, the tibia, and the patella. These three bones form two joints of the knee complex. The tibiofemoral joint, which is comprised of the distal femur and the proximal tibia, and the patellofemoral joint, which is comprised of the distal femur and the patella. The meniscus is joined by a number of other passive, non-contractile structures to provide stability to the knee. These include the joint capsule, the anterior cruciate ligament, the posterior cruciate ligament, the medial collateral ligament, and the lateral collateral ligament. The meniscus of the knee is composed of two semicircular shaped fibrocartilages, one medial and one lateral, that rest on the tibial condyles. The wedge-shaped anatomy of the meniscus highlights a thicker periphery and a more shallow central border. In an anterior to posterior direction, you will see the ends of each meniscus, called the anterior horn and the posterior horn, respectively. This wedge-shaped meniscus accommodates the shape of the femoral condyles and enhances stability of the knee. The stability of the meniscus is also found in its attachments to other anatomical structures. Both the medial and lateral meniscus attach to the intercondylar tubercles of the tibia via the anterior and posterior horns. The coronary ligaments at the tibial condyles serve as another connection. And finally, both menisci are attached to each other anteriorly via the transverse ligament. The medial meniscus has a unique and deep attachment to the MCL and a posterior attachment to the semimembranosus muscle. The LCL has unique posterior connections to the PCL, the posterior meniscofemoral ligament, and the popliteus muscle.